nurse, so I don't know, it's going to be a rough day, but I think we'll make it work.
Did anyone fill in for Lisa today?
I don't know, I guess Tony was the charge nurse, and she either got too busy or she forgot to call. She was like running around when I was talking to her, so we'll get a report and we'll see if I can call somebody later to come in for at least 8 hours or something. I don't know.
Well, thank goodness I got a lot of sleep last night. How many patients are on the floor right now?
Yeah, how many patients are there? I stayed up all night watching the Tigers, so maybe I have to go grab some coffee.
I guess there are 12 patients, so we'll each take 4.
Okay.
The good thing is I kind of picked them based on our strength. So since you're really good at wound care, I'm giving you beds 1 and 2 in both 49 and 50. Okay. And you were here yesterday, right?
Yeah.
Okay, so did you have beds 1 and 2 in 51 and 52?
Exactly, I did.
Perfect. So you can have those again, and I'll take beds 1 and 2 in 53 and 54. So most of them are stable, I hear, but a lot of them are on their call lights frequently, so
Lovely.
we'll have to be watching for those. Night shift said that the patient 49B is on bed rest. He keeps getting out of bed.
Oh.
So they turned his bed alarm on last night. He slept most of the night, but they said this morning he keeps trying to get out, so we're going to all have to be really listening for that bed alarm.
Great, that's my patient. Well, he better stay in that bed. You know what I think I'm going to do? I'm going to call Dr. Earl and get an order for restraints.
Yeah, I'll help you out whenever I can.
Thank you.
I'll help too, but I don't think that calling Dr. Earl for restraints is a good idea. He's not combative, they didn't say, and so I really don't think we should restrain the patient unless there's a really good reason. Let's see how it goes. Maybe we'll call Dr. Earl later and request a sitter.
Yeah, I guess a sitter would be a good idea. I'll figure it out after my shift assessment.
Okay. Alright, well, before we go out and get our reports, I have something for you guys. These are evidence-based articles on DVT prevention. I guess some of the nurses in our unit aren't making their patients wear their SCDs. I don't know if their patients complain they're too hot to have them on or what's going on. So Marcia got all worked up about it, and so she found this article, and you're responsible to read it, so please read it. Also, she said next week we're having a guest speaker come in on DVT prevention, so definitely read it before that. It'd definitely be a good idea. Alright, let's go get our reports.
Let's do this.
Okay. Hey, Melissa.
Hi, how are you?
Not too bad. So I just got a report and checked out my patients real quick. I'm going to use the computer here to look and see if there are any new meds up and check my orders. And then maybe you can cover for me while I get a coffee?
I mean, I guess I could, but I really need to check on my patients first. You know, that 49B is lucky that his sister's in there because he will not calm down, he will not stay in his bed. I knew today was going to be long. Is it 7 yet?
Have you guys already looked through your charts and gotten everything taken care of yet?
Not really.
Okay, well, Melissa, you're a patient for 9B. Just pull his IV out of his arm.
Oh, great.
I was in there, well, I was walking past his room, his call light went in, so I ran in there as soon as I could. It was already out, it was already dripping, so.
Alright, I guess I'll be right there.
Bernard, keep looking up your patient.
Mr. Poppy's going to have to wait.
Oh man. So there's so much to do in my patient's room 51 that, you know, I changed the Lasix, but I had to call a doctor first. So they weren't answering.
Yeah.
And besides the Lasix, I had to lower the drip rate from 150 to 100 because I heard crackles during assessment with the patient.
Yeah.
So there's just a lot going on.
Yeah. Well, you know, I hope I get a call back soon from my doctor because my patient's just being really combative and I think he really needs restraints. But did you say you lowered his drip rate?
Yeah, I did. I thought it was a good idea because the crackling was so bad that I just figured I'd call a doctor. But, oh wait, well, my phone's ringing right now. So I'm
Melissa?
answering.
Alright. Hey Melissa, did you get the IV in 49B?
You know what, I did, but I'm not sure that he's gonna not pull that out again. Like, I'm getting really worried. He's getting combative. He won't stay in his bed. I just really think that we need restraints. Like, we need to do this.
Well, good job getting it in. Did you call Dr. Earl? Because I think maybe we can just get a sitter.
All right, I'll go do that.
Okay, call him. Let me know. How's everything going, Bernard?
Not too bad. I just basically, the doctor lowered the Lasix from 10 milligrams.
Oh, the doctor just called you?
Yep.
Okay, good.
To 5 milligrams.
Good.
And he agreed that lowering of the drip rate was fine. So.
Okay, you're lucky he agreed with that.
Mm-hmm.
All right, well, I guess you don't need that coffee right now.
No, I don't.
Back to work.
Mm-hmm.
All right, so I called the doctor about the restraints, and he's just not feeling comfortable putting the patient in restraints at this time.
I figured.
So, yeah, he's suggesting a sitter, and he's thinking that would be a good option. So now we have to make the call to get a sitter, and who knows how long that will take.
I know, I understand, because yesterday we had a patient that needed a sitter, and it took 2 hours for the sitter to show up.
Typical.
So we had an actual nurse in that room monitoring that patient, and it just was such a bad waste of time. Well, why don't you go check on him right now,
Okay.
and if his sister's still in there, tell her his sitter's coming.
Okay, I will.
All right. What's up, Bernard?
Hey Caitlin, so I just checked my patient and he's really congested and he's coughing and
This is the one with the drip rate.
yeah.
Okay.
And I'm really afraid that he might get pneumonia but besides that, like his daughter is really scared that
Well-
he's not coughing anything up.
Make sure he tries to drink some fluids if he can. Make sure he's coughing and deep breathing. And if he's afraid to do that, tell him about the pillow, like being as a splint to help him cough.
Okay.
Does he have an incentive spirometer?
Yeah, he does, but he's not using it.
Okay, well teach him how to use that, because if he's awake, he needs to be doing that like at least 5 times an hour.
You know, that's a good idea.
Yeah.
I'm gonna tell him to do it like every commercial break because he's watching TV.
There you go.
All right.
All right, sounds good.
Okay, so my sitter just got here, and right as she got here, the patient was about to fall out of his bed. Yeah, so
Did
I
the
don't...
alarm go off?
It went off, and right as it was going off, she came into the room and totally prevented him from falling off.
Well, let's just
So-
be happy she's here.
Exactly.
I knew this was going to be a long day, but
I know.
safety is my main issue right now, so.
Okay.
All right, let's get back to work.
All right.
Whew, so that was a rough day.
Yeah,
How are you guys feeling? I mean, I know there were some things that didn't go our way today.
Yeah, I thought today was horrible. My patient almost fell out of bed, he ripped out his IV, and you know what, I barely had time for my other 3 patients. My time management wasn't the best, I guess.
Yeah, I changed an order before getting clarification from the doctor. I really figured it was the best thing for the patient at the time, though.
Yeah, and I'm sorry I wasn't able to help you guys that much. I mean, my patients were busy too, and I didn't even get around to calling an extra staff member to come in and help us. But I guess the good thing is safety was maintained because we got that sitter and we got the respiratory therapist to look at your patient. So
Yeah, I would never survive without it.
yeah. All right. Well, this is a new thing we're doing. I'm going to have you guys fill out these forms. It's just to have you like reflect on your day and what could have been improved. And this unit is really cracking down on improving our patient-centered care. So take a minute, fill these out about your day, reflect on it, and you guys back tomorrow?
Yep, we are.
No, tomorrow's my day off.
Oh,
Oh,
Lucky.
well, aren't you lucky?
well, I'll see you.
All right, see
All
ya.
right, bye guys.
Bye.
Boy, I really need this coffee.
Somebody save me. Let your warm hands break right through. Somebody save me. I don't care.
Hey, Melissa.
Hey.